everyone, I am Shahan Layek. Welcome back to my channel. And there are a lot of questions that came to me in my Instagram handle where people are asking, can a COVID patient or can a COVID suspecting mother breastfeed her child? So this video will be regarding COVID-19 and breastfeeding. So let us learn in details about what a mother can do if she is suspecting to have some fever or cough. She may be suspecting of COVID-19 or the mother is having COVID-19. So what should she do? Will she allow her child to breastfeed or will she deprive her child from breastfeeding? So the first and the foremost thing is, number one, do not deprive your child from breastfeeding. Do not deprive your child from breastfeeding, which is very, very important. You know, breastfeeding, in breastfeeding there is a lot of benefit. The milk contains IgA, mother's IgA, that comes through the duct of the breast and it comes in the mouth of the baby and it protects the baby from various other disease conditions. So that is very, very important, even more important than contacting COVID-19. So always remember, do not deprive your child from breastfeeding. But during the breastfeeding, you need to do some precaution. So what are the precautions that should a COVID-19 patient mother follow during breastfeeding? So let us point it out here. Number one is hand hygiene. So hand hygiene should be maintained. When you are breastfeeding your child, you must wash your hand for 20 seconds or 30 seconds with the help of soap or with the help of liquid soap or with the help of sanitizer. You can sanitize your hand. After that, you can take your baby and next thing, number two is try to sanitize the surfaces. So any kind of surfaces, it may be the surface of the table, it may be the surface of the door, it may be the door handles, it may be your mobile phone or the toys of the baby, whichever the baby is, maybe the cradle of the baby. So whichever the baby is using, you must sanitize that. So these are the very important points, and there are other points also. Let me erase this part and let us discuss about the other points which you need to remember while you are breastfeeding your child. Number three is you must maintain a 6 feet distance between you, this is you, okay, and this is your baby. So you must maintain a 6 feet distance. If you are keeping your baby inside your room, you can keep, but you must keep the baby in a distant place. So that is also very much important so that the virus do not transmit. While you are breastfeeding, it's okay to keep the baby on your lap, but on other time you can keep your baby in your room but with a distance. Number four is always wear mask. Always wear mask in your room. Especially at the time when you are breastfeeding, you must wear mask. So that will help you, that will reduce the chance to transmit the virus from the mother to the child. Next important point is you must use tissue paper. You must use tissue paper for you must use tissue paper when you are coughing. So when you are coughing, you must use tissue paper and cough on the tissue paper, then you throw and dispose the tissue paper properly in the dustbin. So that is very, very important. So all these things you need to remember, and you do not deprive your child from breastfeeding, because that is the best milk available on earth. Only for those patient who are in ICU, only for those patients who are having a problem because they are in critical condition, their clinical condition is not allowing them to breastfeed. So those patients who are in ICU, those patients who are critically ill, so only those patients are not allowed to breastfeed their child because of their clinical conditions. So for them, they can take the human milk. They can take out human milk from the human milk bank. So you can take human milk from the human milk bank, and you can give a caregiver to breastfeed your child. So there is no such alternative for the breast milk. So this is an awareness. Any COVID patient or any mother who is suspecting of cough and little fever and all this, who is suspecting of having COVID-19, they must breastfeed their child. There is no point in depriving your child from breastfeeding. And this is the end of this video. If you like this video, make a thumbs up and subscribe our channel. We will make many more medical videos for helping MBBS students across the globe. Thank you so much for supporting this channel, and if you like this channel, please share this channel with your friends so that many more students can get benefit from it. Thank you so much. Bye bye.